He came into the clinic limping and saying that his knee hurt. And this is a child we actually see pretty often, and I didn't really think too much about it. I thought it was just a kid wanting to get out of class for a minute. But then when he pulled up his pants, you could actually see that it was infected. It had started as a little scrape, and kids often pick at lesions, and it had gotten infected, and it was right over the knee joint, which is very concerning when you have an infection over the joint, because it can spread into the joint or even into the bone. So the knee was swollen, it was warm, it was obviously very painful. He had a fever that day, and so I called, talked with his grandmother who he lives with, and she gave me the history that it had been a lesion, and it had been about a week that it was there. And so I said, well, he really needs antibiotics, and stressed the importance, and was able to call them in and talk to her about some other ways to treat it. And she didn't have to take the child anyplace else. We knew he got treatment that day. We got the medication started, and then I was also able to follow up the next 2 days to be sure that it was healing and that it wasn't getting any worse. So if I hadn't been there in the clinic, he may have come down to the clinic, they may have put a Band-Aid on it, but it could have gotten worse. He could have even ended up hospitalized if it hadn't been caught in a timely manner. There's not a lot of doctors in town as far as primary care providers. A few of them will use the local primary care providers. When I ask about their pediatrician, they mention somebody in Tallahassee. A lot of them use the ER as their main source. Either they don't have money for gas, or don't have a car, or whatever the case may be, unless it's dire, they don't feel that it's urgent, and they would just stay local, and again might utilize the ER if they feel like they need something.
A lot of the parents do have Medicaid, and they might have insurance if they're residents of the U.S., but when the parents have to leave work, and largely they're blue-collar positions, so the family does lose income. I also see a lot of migrant worker children who are on temporary visas, so they do not have the luxury of health care. So for many of the children, we are their safety net. Many of the migrant kids in particular, the only time they would have health care is if it were a true emergency situation. So we are working with the migrant community to do well child visits, to teach the families about preventing dental tooth decay and things like that, and as well as managing asthma and diabetes.
Thank you very much for dancing and raising the money. I've worked not only for the College of Medicine, but I've also worked in hospitals, and I know the money goes to several of the hospitals in the area as well as Gainesville, and so I've seen kind of both ends, from the primary care and the acute care, and it really helps the kids and the families when we have additional services that we can provide. And so even though all the students can't be out in Gadsden County and actually see the kids, but they're awesome. They're so much fun to work with. Even like from a little kid with a scrape on a knee that was in a lot of pain, I was able to help him, and the funds that you raised and all the dancing that you did was really beneficial to this little 5 or 6 year old.